Hi, everyone, and welcome to MedEdge. I'm Marcus Grimm. So a quick reminder, MedEdge is brought to you by Medtrics. Medtrics is the premier engagement platform for both UME and GME students, residents, faculty, and administrators. You can learn more at medtricslab.com or from my frequent co-host, Dr. Santosh Cherian, CEO of Medtrics. But not today. Tosh is taking care of those customers, and we're glad he is. Listeners of MedEdge know that we recently had several episodes featuring new students that had just completed the grueling match day process, where they learned where they will be doing their residency for the next couple years of their training. Now, despite the fact that these young men and women had emerged from a grueling gauntlet of exams, EROS applications, and interviews, one word we never heard during any of those interviews was the word burnout. To a person, they were excited, motivated, passionate, all the things that tell us a person is on the right track to career and personal satisfaction. But let's flip the coin. We are seeing that burnout, in fact, is real. Doctors, nurses, and others in the healthcare profession, they're leaving their practices or even the profession at higher levels than ever. So what's happening? Well, today's guest is going to walk us through a lot of it and how we can protect not just the next generation of healthcare workers, but this one as well. Listen to this introduction. We're joined today by Dr. Tamara Beckford. Tamara is a board-certified emergency medicine physician, author, speaker, and CEO of You Are Caring Docs. That's the letter U, the letter R, Caring Docs. I love that name. She trains companies on employee wellness strategies that reduce stress in the workplace, improve retention, and help lower healthcare-related costs. You might have heard of her before. She hosts the Dr. Tamara Beckford Show, and she's interviewed over 245 physicians about self-care and their work outside clinical medicine. Dr. Beckford has been featured in Forbes, Yahoo Finance, Voyage Houston, LinkedIn News, Rolling Out Magazine, Kevin MD, the list goes on and on. She has also appeared as an expert on over 70 podcasts. I'm not sure if we're 71, 72, or 79. She talks about wellness, burnout, and stress management. By the way, her podcast, it's ranked in the top 3% of podcasts globally. She has presented about wellness on many platforms, including Power to Fly, the Grants Professional Association, Centerpoint Energy. The list goes on and on. She's co-authored 2 best-selling books, Made for More and Thriving After Burnout. The New Jersey Academy of Sciences recognized her as a COVID-19 hero because of her work during the pandemic. Tamara, welcome to MedEdge. We're thrilled to have you here.
Thank you so much. I am excited to be here. What a wonderful way to come on in right after all the match day excitement. Let's keep everyone motivated, and I am excited to give as much info as possible so that we can prevent these new incoming doctors, the rising doctors. That's how we like to call them, rising doctors. Keep them motivated and out of burnout.
Oh, wonderful. We're thrilled to have you here. Our audience is made up of this UME and GME community. So it's funny because whenever you talk to anyone in UME and GME, like, They want to know about the logos. They want to know about the brands of the schools that you've been to. So I took a look. We've got undergraduate at Montclair State, med school at Rutgers. One of the residents that we hired went to Rutgers, and residency at Jefferson Health. I'm seeing the tri-state there. Are you from New Jersey?
I am a Jersey. So originally born in Jamaica, and family moved to the U.S. I grew up in New Jersey. And I actually grew up in Newark, New Jersey for a part of my life. And, we'll go, as we get into the story, you'll find out how it turned full circle. So went to undergrad at Montclair State University, also did grad school there. And then went to medical school. At the time, it was UMDNJ, the University of Medicine and Dentistry of New Jersey. For others, it was an alphabet soup, but we loved it. But now it's called Rutgers New Jersey Medical School.
It's funny, and there's a lot of alphabet soup.
A lot of alphabet soup.
Now, your undergrad was in biology, so often that's a tip-off that somebody was thinking about med school at the time. Was that you? How, at what point did you say, medicine's the direction I want to head?
Well, medicine was a direction. I got a snippet of an idea that it would be medicine while I was in high school. As I mentioned, I grew up in Newark, and at the time, Newark still, for certain parts, had to deal with a lot of crime, a lot of drugs. So during the summer, what does one do with I was the only child at the time, young female, that you want to ensure that can be productive citizen. So you look for summer programs. So there were summer programs available within the area. And there was one that was almost like a health introduction to health careers. So initially I thought I was actually going to be a pharmacist. So when I went in, I was there with the pharmacist right at the medical school. And they didn't know what to do with a 14-year-old who hadn't really done chemistry or any of the detailed basic sciences. So they put me in the basement where the pharmacy was. And they said, oh, you can file these medical records. Now, that was the time before it was electronic medical records. It was just literally manila folders. And we still had 9 numbers, and I'm trying to organize these folders. And that summer I said, I don't think that this is what I want to do. I'm saying the pharmacists are not talking to anyone. They're not connecting. So I applied the next year, and I got to shadow a physician, and the light bulb went off.
Yeah.
The interaction, I said, oh, this is what I want to do. And therefore I applied to Montclair State. Montclair State still has this wonderful program, which is called the Health Careers Program for those who want to do something within the careers. I applied, got accepted to that program. And, the rest is that for the undergrad I actually attended grad school there too. And had the wonderful honor of being in grad school and being tutored by one of my absolute mentor, Dr. Sandra Adams. We still connect to this day. Like I just texted her like 3 weeks ago. And she, and a lot of the other faculty there at Montclair State helped to mold me and helped to build a lot of the confidence that I needed in order to apply and do well in medical school. So that's how the introduction to it, got there. And for those who aren't aware of Montclair State University, it used to be a small, it's gotten a lot larger university. It's in Montclair, New Jersey, this is all northern New Jersey for those who are listening from other parts of the country. And we're around maybe like 15 miles away from New York City. So that's how northern we are. So it's a great intro, and the school helped to build I wasn't ready to go to a large university at that time. I wanted a little bit more of a nestled, because I still was an immigrant and I still wanted to feel comfortable in this country that is now mine.
The selection of schools a big one. Another one that's a huge one for those of you in medicine is specialty.
Yes.
I always like to ask that question. And we're coming off this series with the med students. And, we've got people that have said, this is what I wanted to do from day one. These were my 3. I got into my 3rd one. Your specialty ended up being emergency medicine. Just kind of walk us through that. Was it the 3rd of 3, or was it like, that's what I want to go for? How did you go through your specialty selection?
It was I entered into medical school knowing that I wanted to do emergency medicine. And it's all secondary to, you'll notice a pattern in my story. It's all about exposure. So while I was in undergrad, I did programs, and it exposed me to a couple different health careers and the different specialties. So I had not known about emergency medicine, even in undergrad. And I had the honor of, there's a hospital in Newark called Newark Beth Israel Medical Center. I got to shadow an ER doctor. Her name is Dr. Shapiro. I don't know if she's still there or anything. Doesn't even remember me. That's how much of an impact you have on someone. They shadowed you. You don't even remember them, but then their lives change. At the time, she was pregnant. She was taking care of patients. It was a teaching hospital, so she had residents. And I was that quiet person just looking and observing. And I said, wow, I love the way that the staff interacted. I love the way she was able to command the room. And when we hear the word command, a lot of times some people might think with a negative connotation, but it's not. It's just really, it's kind of like orchestrate. It's like a harmony, like a conductor, how you can orchestrate things and things happen. And I started to get this inkling, like, I think I might want to do this. And at And then afterwards, medical school, which we said is Rutgers, New Jersey Medical School. That's a trauma one, level one trauma hospital, right in the heart of Newark, New Jersey. Got the opportunity to do some shadowing there while in med school, made them aware like, hey, I think this might be what I want to do. Had another wonderful, wonderful mentor there, and it just stuck. So what I did though, and I would implore, like, I know that for those who are listening, you're at different phases in medicine. We have all the ones who are in administration to those who are applying. Although I had an inkling that that's what I wanted to do when I entered medical school, I still entered with my mind open. I didn't go in closed and say, well, it's EM or die. I said, you know what? I love emergency medicine, but I don't know what it's going to be like. So let me keep my mind open to all the specialties while I'm rotating. And in the end, it all came back. Okay, this is it.
Well, let me ask you a question about that. One of the things, and oftentimes when Tosh and I are on the program, he's an emergency room radiologist, and we often joke about, and obviously we all want to be careful with the term stereotypes, but there are certain stereotypes as they relate to medicine. We talk about oncologists just having empathy levels that are really, really high. Surgeons who are more comfortable with risk, but maybe not as good at doing all those evaluations and paperwork afterward.
Mm-hmm.
I've never spoken to someone like yourself, an ER doc, but it's interesting to me that you talk about that you're open-minded. And it would seem to me that if we were to build a stereotype about an ER doc, you see a little bit of everything, right? So can you talk about what some of the maybe stereotypes we can expect to see from an ER doc?
Okay. And this is in most ER docs have great sense of humor. And so I'm going to give you an idea. So do you guys remember MacGyver?
Oh, yeah. Oh, yeah.
So that's an ER doc right there.
I love that.
That is an ER doc, in that anything that comes our way, we are trained to handle, in the sense as we might not have learned it, but we've learned something adjacent to it, and we apply what we know to that situation. So because the emergency room is sometimes the catch-all for society, and it would be great to say, well, I didn't learn how to do this, so I'm sorry, you're going to have to go somewhere else. But it doesn't happen in the ER. So the other way that I describe emergency medicine is that we're the great stabilizer. So people might say, you'll at times hear some people use well, you guys are jack of trades and master of none. We are master at stabilizing things. So when chaos ensues, we stabilize, and then we can move on and move the patient onto the next person who might be able to do the definitive care. But we're the one that stabilizes the uncertainty. So when they step in, the first rash is there, where by the time they get to their dermatologist, maybe the entire area is filled with rash. But when they come to us, they probably only have one. And so we're trying to figure that out. When they come to us, the blood pressure is tanking, like almost to the point that they're coding, or they are coding. But what do? We stabilize, we bring them up to a point where they're level and stable enough to be transferred to the next provider, the next specialist. And so we're master at stabilizing. And I call us MacGyver because sometimes we don't have all the equipment, and we have to sit and think and say, well, if we use this, and I've done it, I've made things and boom, it worked. And the patients are like, oh, this is great. And I'm thinking, I just MacGyvered that.
I love that. And what a fascinating pivot point, because now we're going to start talking about burnout. I watched every Soda MacGyver in the 80s and 90s, not unlike our med students. Not once was MacGyver too burned out to do anything. So let's talk about how we preserve that excitement, that vibrance. Today, your business is all about identifying, correcting, and solving burnout in medical practices. And I find that when it comes to this idea of preventing burnout, a lot of it's tied to resilience. And I tend to find that I often find people, the people who do the type of work you do, they either come from two different backgrounds. The first is they're naturally bulletproof, and somebody says, you know what, you got to figure out how to bottle that up and sell that to other people. Or they're people that found themselves in a difficult time, were able to pull themselves through it, and you're like, okay, this helped me, so I want to help other people. You've said and you've written that COVID was a pivotal time for you. And I'm wondering, when you think about it through that lens, did you find that you were just better equipped than others to deal with this? Or were you going through it and raising your hand and saying, something's got to change here?
So I am a bit of both. I can say, that I did not crash and burn during that time. And it was the lack of crashing and burning that made me say, whoa, well, what is it that you did that made you not crash and burn? Because as we've been talking throughout, I'm an emergency medicine physician, and that was the pivotal moment where emergency and all those who were frontline workers, we were in the biggest part of the uncertainty with this virus that we had no idea of how it affected. What are the long-term effects? What are the immediate effects? And also keeping in mind, we're professionals. I'm an ER doc, but I'm also a mother and I'm also a wife. And am I bringing this home to my then 1.5-year-old? All of these things come into your mind. So why is it that I did not crash and burn? When I looked back, I realized that I started doing certain things prior to COVID. And this was in 2019. I, got to that point in medicine and I'm like, there has to be more that I can give to the world. What is it? What is it? And then I started reading a little bit more and doing more personal development. And that entailed finding, working on my mindset, which is a huge thing. And in medicine, it's such an important part of preventing burnout, but I don't think we address it as much because it's just something we just think we just do. So we do until we don't do it anymore. But I started working on my mindset, a lot more personal development, learning little techniques, just, wow, this is incorporating morning routines or wake up routines, as I call them, really tapping into things that brought joy to me that I started to ignore because everything was just related to medicine. That's one of the things about medicine. It takes over your life.
Right. And you mentioned that you actually, so the timing on this is interesting. You actually started doing some of that work prior to COVID. So I'm almost getting the idea that through luck, you almost had a little bit of an inoculation heading into COVID.
Absolutely.
You mentioned a key part of your own personal success was hiring a coach. Had you done that prior to COVID, or was that in the midst of it that you were like, no, I need to up my game here? How did that happen?
I did the hiring of the coach during COVID. What that brought about is another important aspect, which is community. See, COVID brought about a lot of isolation, and people within medicine, like I said, medicine can take over one's life, and it's not in a bad way, but it just takes over your life. That's the dedication to the craft, to the science. But when you're going through parts of medicine that can be the emotionally detrimental part, unfortunately, naturally people silo themselves. And then they feel like they're the only ones going through it. With me, the coach that I had, was a business coach, but we also had a community, which I still have right now. And in that community, you realized that you weren't the only one that felt that way. And that brought about such comfort. So it wasn't a community where we're all saying, whining and woe is me. It's a community that brought upliftment and, well, what is it that we can do to better ourselves and to better whatever it is that you want to do within your grasp? You have a medical degree. So that means you have the ability to learn. You have skill sets that's way beyond medicine, but you might have suppressed them because thinking that's the only thing that you can do. So now you're in a community when everyone's coming up with creative ideas. You do that too. And what that does is that creativity makes you start to reflect, and you're no longer feeling the effects of burnout because you're feeling joy and excitement. With burnout, there's an absence of that, right? It's the depletion, the emotional exhaustion. That's what's happening, the cynicism. So now you start having the opposite of cynicism. You have excitement because I'm birthing something new. I am solving problems that are different than the ones that is naturally within my realm. That's how the coaching helped.
That's great advice. Now, I'm guessing that I think a lot of people and that haven't done this hard work that you have, they might look at themselves and they're like, I don't know, am I burned out, or did I just have a bad day, or what's going on? And I'm a big believer that, before you can fix anything, you really need to understand it. And you wrote on your website, and your website, by the way, just has all kinds of great stuff, but you recently wrote a post about something that you call the Copenhagen Burnout Inventory, which to me, if I'm listening to this program and I'm like, well, I don't know, am I just tired? Is it a tough time? I feel like this Copenhagen Burnout Inventory can kind of help me say, hey, listen, let's take a hard look at what's going on here. Tell us more about that tool and how you use it in your practice.
Absolutely. So actually during my presentations, I have all of those who are in attendance do a burnout survey. And this burnout survey, it's not only a shock and awe, but it's just giving you an idea where you are at this time. Because burnout is a gradient and it's a phase. And I often say that it's not something that just happens night and day. It sneaks in on you. And so this survey really gives you an idea of where am I on the realm of burnout. And for those who you hear the term burnout, but you might not even understand, like, what is this? Like, you're like, oh, I'm just tired. It's just the weekend. As soon as I get over the weekend, I'll be able to get back on jolt up. No, that's not burnout. Burnout, the weekend does not help you to recover from it. Like I call it the 3 Ds in burnout. So you have the emotional exhaustion, which I call depletion. You have cynicism, which I call detachment. So you're detaching yourself. For those of you who are in medicine and we're working in this, that's when you have that patient and the patient's talking to you, they're pouring their heart out and you're just like, yeah, just get to the point. Just get to the point. Like, so now but if you think about all the med students that just matched, all of them will sit with enthusiasm to listen to that patient. So that's how burnout, that's a difference. And then you have the decreased sense of accomplishment where you're doing powerful work, you're changing lives, but you don't feel that accomplishment from it. So when we have that and you use that scale, you realize like, wow, I am feeling some of this. And so we use that tool to get you to where you are and then try to revert you from the phases of burnout. Because the last phase of burnout is what I call is the critical phase. And that one, I call it a bridge to the mental illness, which is the bridge to depression, the bridge to, unfortunately, what's happening with some of our 400 physicians a year, die by suicide. So that's that bridge that we're trying to avoid our members from crossing.
Let me ask you a really tough question about the burnout conversation. This actually came up. We did a wonderful episode with Dr. Lee Scheinbart. Now, Dr. Lee Scheinbart, he's an admin in the hospital system, and he wisely recognized that burnout, sometimes we ascribe it to being a personal thing or a personal challenge, when the reality is that sometimes if these health practices sort of turn the lens on themselves, they'll realize that they're setting up an environment that's going to lead to burnout.
Absolutely.
So much of the work that you're doing is just from what I'm hearing, it's about personal agency. It's how I can inoculate myself regardless of the environment. But let's be honest, like the environment can be a big factor. So in your work, do you try to help organizations at the admin level, or do you try to focus more at the physician level, or do you believe that it's really we got to attack this from both sides? How do you think about that?
I think it's an attack from both sides. The first part in the attack from the admin level is for admin to acknowledge this. And so the fact that you have an admin that's acknowledging it, then, we've already started to crack that wall. Now, it is also important that it is multifactorial. And you're right, there is a certain personal portion to it, and then there's the administrative portion. One of the challenge with medicine, and I even see it now too, is when you improve upon a process, then you're expected to do more, faster. It continues. So your reward for doing well is more work. And that is medicine. So now we have to sit and decide, like, and interestingly, I'm reading it, Simon Sinek, The Infinite Game right now. So for this infinite game in medicine, like when is enough from the administration on the physician? So we have matrix. We've now hit these matrix. Are we happy with the matrix, or do we keep shifting the matrix? When we keep shifting the matrix, because people naturally they're goal oriented and they like to achieve goals. Now, when the goalpost keeps moving, eventually the people will run out of steam. And that's the burnout portion. So when you have a team from an administrative standpoint that's hitting the matrix and you're getting the numbers that you want, what is the issue with trying to maintain those numbers? Why do we need to say, well, if we were able to do this, well, why don't we shift it more? And then the burden now gets put on. Who is it getting put on? It's getting put on the physicians. Physicians naturally, we're natural givers. 15 years of our lives we give. This is just a natural ingrained portion of our personalities. And we will keep trying. And unfortunately, to some people's demise. And that's when we start to lose our physicians.
That is so well said. I mean, you're absolutely right. That nobody that I've spoken to in your position is a coaster. That they're all constantly pushing ahead. So you move the goalposts. Okay, I'll chase that. I'll chase that. I'll chase that. And then eventually you find I'm exhausted. I can't chase it anymore.
Absolutely.
So here's a question for you. One of the challenges with medical education is there is so much to learn. So some fairly, truly you learn the practice of medicine, but you've been doing this a while. So obviously there's a lot more to it than just the medicine. So, we've interviewed physicians on this program that have gone into direct pay, and suddenly they're like, wow, I got to learn how to do marketing or I got to learn how to do billing. And they didn't teach me that in med school. And I'm trying to wrap my head around, again, these newly minted residents that I've interviewed. They certainly don't look like they need burnout training, but maybe they should. Like if you could, speak you are speaking directly to our UME and GME audience. How should we be thinking about putting these tools into medical training? And to be clear, that's a tough question. The direct pay doctor I spoke with said, you know what, Marcus, there's no time in med school to teach me how to do marketing. So I don't expect them to do that. But when you're talking about a really hardcore life skills, how do we or should we try to make these part of med school training? How would you do that?
Should we make this a part of med school training? Absolutely. I think one of the ways that we can, if you're from the standpoint of administration and, like we said, from the GME standpoint, let's not reinvent the wheel. We have other specialties who are doing it. And when they finish school with certain skills, such as our dental school. So my med school, the beauty of it is that the difference between the med school and the dental school was one door. And so the dental students, they'll walk through and their lockers were right next to ours. One of the things with dental students, once they finish dental school, what are they opening?
A business.
A practice. Yeah. So the third year, from the time they hit third year of dental school, they have to go find their own patients. They have to find their own, they have to learn these skills. It's not to say that we are going to throw that into our medical education, but why can't we find out what is it that you got? Because dentistry has been it's a long sister of medicine. What is it within their education and how are they able to integrate that? That's one. Another professional school that as soon as they leave, they're opening practices, the chiropractors. What is it that you're able to integrate into your education? How are you able to integrate certain portions? Those who are the optometrists. So we have other specialties that have been able to incorporate some of this. Why don't we just have a sit down and learn how they're integrating it and what part we can use within our medical school training. Now, rest assured, yes, is our medical school training packed and jam-packed? Absolutely. But what use is it if we are pouring out the doctors and then the doctors are no longer staying in medicine?
Right. Absolutely. Absolutely. And we've talked about this, right? That there's only so many resident slots in the United States. So if you have, if the percentage of people who go into the practice ends up being higher that leave, then you've got a real problem. And we see these healthcare shortages and we see everything that's happened, which just prevents, having fewer doctors in the ER does not help you with burnout.
No, absolutely not. And these are, and some, the thing about, all of these skills too, and, like I said, I'm being coached by a business coach, and she's a physician. She's opened her practice. She's figured out how to teach these. And honestly, it's amazing because I see my physician colleagues who were being employed physicians decided that, I want to open up the practice so that I can do it my way. And not everyone were direct pay. Not everyone is DPC. Some, they still take insurance, and they've opened up their practice, and they've been able to, within 2 years. Actually, I'll give you an actual one. One of my friends who went to my same medical school. So we've known each other from 2003. Yeah. And she's here in the Texas area also. In 2001, she opened up her practice, and she has been able to serve 7,000 patients in her practice. She started from zero. And it's with learning these skills so we had none of these business skills. She now has a practice where she has 20 employees, a very successful multiple 7-figure practice where she's able to bring in, she has mentored students. She said mentor students who are now going into medical school. So you see how the pattern continues, but it's learning these skills, the learning how to market, learning all these skills. They're important for us. So the joy in medicine, that's the joy in medicine right there.
That's incredible. That's a great story. Now, I made the statement early on the show that none of these students showed me one sign of burnout. Now, that being said, I don't do what you do. I don't analyze, identify, and correct burnout. You've got a great blog post called "The Truth Behind Burnout and High Performers," and there's a lot of good stuff in there. But one of the things that's in there is those high performers are probably feeling a lot more stressed than they might show. So my question for you is, you didn't see me interview them, but were they playing me? Or maybe a more serious question, is it one of those things that we need to be checking in with people because you don't really see what's going on inside?
They were not playing you. There was true excitement. You said that these are people who just matched. I remember when I matched. Oh my goodness. So you have to keep in mind, I'm ER. So our mindset is a little bit different. And that's a caveat. So when you have the excitement at the beginning, that's the adrenaline rush, right? What happens after a while? Adrenaline wears off, and then reality kicks in. So, will these people burn out? Probably at one point or the other. So should we check in with them? Absolutely. Now, one of the things that makes us, especially as physicians, very prone to burnout is that a lot of us have type A personalities. And it's similar to what we mentioned in that we go, we give our all. If 10 is good, then 15 is better. And that's what we're going to go for. That's our mindset. So should we tap in and check in with all of them at one point or the other? Absolutely. Because they're going to go through it. And the challenge is that when they go through these burnout and even the symptoms of burnout, a lot will mask it because they feel as if it's a sign of weakness. And it's important to recognize that it's not a sign of weakness. this is when you need to be able to tap in and use the tools that are available to help you to not cross that bridge, as I mentioned, to the crisis phase.
Is there an apt analogy here? I think often we talk about in medicine, right? Certain conditions, like there's a point that you want to go see the doctor. There's a point you really need to go see the doctor. And then there's a point that it might be too late. Would you say it's the same thing with burnout? Like you want to look for those early signs, and then what are they?
Yes, absolutely. So you do want to look for the early signs. So the first phase of burnout is the honeymoon phase, which is what you just saw those people excited because they're going to change the world, right? Yes. Can you imagine? You just spoke to me when I just matched. Do you know what I'm going to be doing as an ER doctor? Changing the world. Then the first phase is the onset of stress. So at that phase, they'll probably start to feel a little bit overwhelmed, but they can control it, right? The third phase is the chronic stress phase. And that's when you'll start to have some of those symptoms that just might not seem to be going away, where, yeah, I'm having headaches. Yeah, I'm having belly pains. Yeah, I don't feel like I can grasp what's going on. And then the challenge, especially with medical education, is that while we are training and we're doing things, we're being tested consistently. So at the end of every rotation, at the end of everything, you're taking a standardized test. Every year, you're taking a standardized test. So even though you're training and you're doing well, in residency, you have what's called the shelf. I think it's still the shelf. So you're still being tested. So if you do well clinically and do poor on the standardized test, you can imagine what that happens to the psyche, right? So yes, it's good to be able to tap in and keep them. The fourth phase is the actual burnout phase that we talked about. When you're having portions where you are feeling overwhelmed, you're starting to have thoughts that I don't think that I belong here. Everyone else is better than me. Everyone else knows what's going on except me. Even when your colleagues might be saying, wow, you're doing such a great job, you cannot find the joy in what you're doing on a day-to-day basis. Not, I had a bad day, but consistently, you need to talk to someone.
You have done, searching for that joy is key, right? And I, it's very obvious to me that the only guest, or we have great guests on this show, but your excitement rivals some of those newly minted residents. So you're doing the right thing. Where do you get inspiration? Where do you find joy today?
I find joy in my balance. So which is weird because if people, when they, as you read what I do, it's just like, well, how are you doing all of this? I get to balance. So I love doing clinical work. I do clinical work in the first half of the week. And the second half of the week, I do the creative work, coming up with ways on how to help to offset burnout. What are some ways? How can I express this? How can I bring in others? How can I speak to others? That's why I do the interviewing. That's why I learn about others and what they do. And then I'm able to embellish that. So what that does, it balances my life. And then I have that balance with that. And then my family, I balance that on the weekends. Those are all little pipettes of joy infused on a weekly basis. And that's what keeps me going.
I love that. And it's a great point too, that, balance, it doesn't just happen. That's intentional on your part. You had to make those choices that I'm not going to practice on these days of the week. So, that is great. We're wrapping up the program here. You've got a newsletter that's called Self-Care Sundays. It goes out to more than 8,000 subscribers. I want to know what readers will find in that newsletter. But as a marketer myself, I always come up with weird questions. Why Sundays?
I know. So Sundays are the beginning of the week. And I actually, we just put out our 100th episode, or I should say of the newsletter, which when I started it was how can I show different ways to incorporate self-care? And it was on Sundays. Sundays are the beginning of my work week. So we put it out on Sundays, on LinkedIn and, on some of the other platforms. And it was all about self-care. So I would really talk about different ways to do self-care, but then I embellished it more from just self-care towards burnout. So self-care is just one of the different aspects of preventing burnout. So it came out on Sunday. It was about self-care. So I was like, we'll call it Self-Care Sundays.
I love it. For anyone who's listening for marketing advice, one of the things that I have found when you do Sunday newsletters is if people subscribe to a Sunday newsletter, they tend to be a pretty high agency person. They tend to show very high engagement. So I wanted to get your thought process on it, and it's probably a good thing every newsletter doesn't come out on a Sunday, but I totally applaud the fact that yours does. Tamara, there's so many good ways for people to get a hold of you, but it seems like your either your website, You Are Carrying Docs, or LinkedIn, or are they your two primary channels, would you say? Yes,
absolutely. I am on LinkedIn every day. And I do my show on LinkedIn every Thursdays. Usually it's in the middle of the day where I get to interview my physician colleagues. And for those who want to work with me, they can contact me through my website. There's a work with me portion there. Or if you're just like curious, right? I mean, I'm here on this podcast. You're like, who is this person? You can find out about the different things that I do on my website.
Dr. Tamara Beckford, thank you so much for joining us today. This has been a lot of fun.
Oh, this has been fantastic. And all those enthusiastic residents, let's keep the enthusiasm going. Make sure you don't burn out. Reach out if you need to.
There's the invitation right now. And I got to tell you, probably not surprised. They're a bunch of high agency people. Probably they will. So you're going to be even busier. This has been a great show. We've been joined by Dr. Tamara Beckford, who is the CEO of You Are Carrying Docs. I just love that name. It's been a great conversation about burnout, how we recognize it, how we avoid it, how we can protect that next generation of healthcare leaders. So thank you so much to Tamara for joining us today. As a reminder, MedEdge is brought to you by our good friends at Medtrics. Medtrics, the premier engagement platform for students, residents, faculty, and administrators for both UME and GME. And we talked about dentistry today, also dentistry programs and veterinary programs as well. You can learn more about them at medtrixlab.com, or from my frequent co-host, Dr. Santosh Cherian from Medtrics. From everyone on the MedEdge team, I'm Marcus Grimm.